Good afternoon. Welcome to my page, Dr. Rekha Segal, Homoeopathy for Mankind. Today I'm going to discuss a very important topic which is prevalent nowadays, that is seasonal bronchitis. Now, what is seasonal bronchitis? Usually, in our clinic, many patients are coming with a stubborn cough, a cough which is there after a acute cold episode, and it is not going in spite of taking all the medication, and this cough is so irritating that the patient is troubled and it is disturbing his routine life. Now, what is seasonal bronchitis? Seasonal bronchitis is the acute inflammation of the bronchial tubes because of this season, especially the winters, and it is uh, resulting into this cough. Now, what could be the presentation? Usually, you get a history that there was an acute cold episode past 4 to 5 days, and after that, this cough is there. Initially, the cough was dry, and thereafter, when the cough is persisting, it has become wet, that is cough with a lot of mucus is there. There could be, with this cough, the shortness of breath is there. Sometimes the patient could complain of sore throat, soreness in the chest, and the mild body ache, lethargic tiredness. Then there could, the patient could present to you with a fever with or without chills, and sometimes you will have only the cough symptom which is prevalent. This cough can disturb the patient's routine also, and now, though, how you will inquire the history, you have to differentiate with the chronic bronchitis. You have to take the history of the patient, that from how long the patient is having this cough episode. Usually the seasonal bronchitis can occur at any age group can be affected with this kind of cough, but in the people with have a history of chronic complaints like asthma or any kind of specific allergies are there you have to differentiate the risk factors also. You have to take the history of their medicines also, whether they are on the heart medications are there, or they are diabetic or thyroid or any particular lung complaints are there. Now, how you will diagnose it? You have to take the history, and if the cough is persisting more than 4 weeks, then it is called as the seasonal bronchitis. What could be the examination? There you have to inquire. You can inquire about the cough, the sputum examination. If it is white, it is usually a viral infection, or if it is yellow or greenish, then it is a bacterial infection. Second, the x-ray of the chest could be taken to rule out the cases of pneumonia. Third, the chest auscultation, you can find the wheezing sound is there, and which can tell you the clear cut indication of bronchitis. Now, how can you prevent? Because prevention is always better than cure. First of all, those who have a history of this kind of any lung complaints should protect themselves from these acute exposure to the cold environment. They can use humidifiers in their house, because moist air always prevent these kind of infections. Third, you have to take a plenty amount of water, take a healthy diet is there, use face mask when you are going out to prevent sudden exposure to these cold environment. And then what could be the homeopathic medicines you can take off? First of all, the first medicine, which is aconite. Aconite is given when there is a sudden exposure to the cold wind and the patient is coming with a high fever which is preceded by chill. Along with this, there is a dry cough and the patient is very restless. He is very restless, plus he is having a lot of anxiety about his problem. There you can prescribe aconite. Second is belladonna. According to the faster pace, the belladonna can be prescribed where there is a dry incessant coughing is there. The cough is so much that the patient is having, because of cough, the patient is having a low part pain in the low part of the throat. and the cough is aggravated by lying down or any kind of exertion, can be troublesome for him. Third medicine is if the patient is not having these kind of symptoms, still it is not benefited, then you can think of bryonia. Bryonia, you will find there is a lot of dry cough is there, and along with this, the cough, because of this dryness of cough, the patient has to hold the chest while coughing. So you will find a distinct pain in the chest, or sometimes pain in the head is also there. And with this, the patient, any kind of exertion can aggravate his cough. So he wants to lie down, and especially if there is a pain in the chest, the pain where there it is paining, the patient is always comfortable in that position also. That is very clear cut indication of bryonia. You can inquire about the thirst also, where you will get a large amount of water intake is there, but at long intervals. And also the dryness history can be seen in the lips region. The lips are very dry, plus there could be an history of constipation also. The next medicine is Ipecac. Ipecac is a very winter friendly medicine, where you will see a lot of cough with a lot of mucus is there, as if the chest is full of mucus. Sometimes the patient could complain of shortness of breath is there, and there is a difficulty in taking breathing difficult is there, and sometimes this cough can end up into vomiting. So Ipecac is a very good medicine which could be prescribed in all these cases. I have given a number of cases and the people are benefited. Usually I prescribe in 30th potency and sometimes in 200 also, but with very less repetitions. The next medicine is phosphorus. In phosphorus, you have to be very cautious because it couldn't be repeated so frequently. And first, second, there is a history of dry cough which is persisting with lot of mucus in the chest is there, and the patient has, because of this cough, there is a lot of hoarseness is there. Because of larynx involvement, the patient could give you the modality that the cough is aggravated by speaking or talking or laughing, and the oversensitive nature of the patient at the level of the mind, also at the level of the physicals also could be relevant. There could be a particular cravings for cold things, and cold drinks also is there. There are other medicines also like antim-tar, which is very good medicine, in which you will find a lot of cough is full of chest. The patient couldn't have a strength to expectorate it out, and the weakness part is very little. Plus incessant coughing ending up into vomiting, antim-tar can be prescribed. Then there is a hyoscyamus. Hyoscyamus cough, you will find a dry spasmodic cough is there, and the patient, as soon as he lies down, the cough gets aggravated. Then the other medicine which comes into the mind is justitia is there. Then Rumex. In Rumex, there is a dry cough, and if the patient is just going out, the cold air aggravates, and there is a lot of tickling sensation in the throat pit. The reason for taking this topic is because the patients are coming with lot of over drug medication because of this stubborn talk. They have taken a lot of antibiotics, although it is not at all useful, or cough syrups also, which ultimately leads to dryness of all these passages, and the cough become resistant and it is not going. Third, there could be a need of bronchodilators, but in a very acute cases, but usually the cough gets settled down with the homeopathic medicine. Sometimes in spite of right simillimum, the patient is not responding, so you can think of certain intercurrent medicines which can be given in these cases, like sulfur or tuberculum, depending upon the need of the case. These are some of the medicines which I have given in my clinical practice nowadays, and I have been benefiting a lot of patients. But you should take this medicine with a proper consultation from an homeopath, and you should be cautious in taking these medicines. If you have any query, you can ask on my number, which is available on my page. Thank you and have a nice day.